Good morning, future doctors. The subject of this class will be based on a study case of cardiovascular diseases. In this case is low heart pressure. My name is Maria Paula and I am from biology studies. The symptoms that Adriana presented was fainting, fever, mild diarrhea, pale skin, and nausea. The background presented by the patient was first that a few hours ago he performed an exercise routine that lasted 3 hours without stopping, and that she do not drink water frequently. This can cause dehydration and heart problems. Her last meal was the night of the previous day, and he consumed vegetables and a protein shake. The lack of proteins like meat, chicken, or pork may affect their personal performance, and that she do not consume food in a large period of the day. And finally, she has no family history of hypertension and heart problems. The medical processes that I assigned was first blood analysis that provide information about general health status, indicate sugar blood levels and low red blood cell count, which are factors that reduce blood pressure. Second, an electrocardiogram that detects irregularities in heart rhythm, structural abnormalities of the heart. Detect if the patient had or has a heart attack. And always an echocardiogram that chest ultrasound show images about the heart. And the transducer transmits the echo and image and creates them that can be seen on screen. Okay. According to the blood test, the patient shows signs of hypoglycemia, which indicates low levels of glucose in the blood that was the main cause of blood pressure. The echocardiogram does not show any abnormality in the structure and function of the heart. This is a good sign because I always mention that echocardiogram is too important because show if the patient has disease or an abnormality in the heart function, and it's too important that they do not mention or result in any disease. Always an electrocardiogram detects irregularities in the heart rate as diastolic pressure of 60 mercury millimeters and systolic pressure of 80 mercury millimeters. Okay, first, the treatment and care that I assigned to the patient was drink more water and increase sugar input in the daily diet because I diagnosed that she doesn't consume the enough sugar input in their diet because she is consuming too much portions of this type of important food. And always one dose of midodrina or Orvaten every 8 hours for 3 days. This medication raises blood pressure levels in the standing position in people suffering from hypertension. Okay, the recommended lifestyle and home remedies. First, drink more water and less alcohol because the alcohol is a dehydrated substance that reduces the heart rate. Always do not sit cross-legged because they stop the flow of the blood and always affect the bloodstream. Eat small portions of carbohydrates. The diet can be variety of food, integral cereal, fruits, vegetables, seafood high in iron. Always the carbohydrates difficult to digest for body, so it will concentrate the blood flow in digesting these foods. Always drink coffee with caffeine once a day. The patient is Adriana Smith. She is a 32-year-old girl with an RH negative. The diastolic pressure is 50 millimeters of mercury and the systolic pressure is 78 mercury millimeters. As you can diagnose, she has a diastolic and systolic pressure too low to the normal pressure of the blood vessels. Finally, I construct a chart that may help you more easily to identify the low blood pressure symptoms and pressure of diastolic and systolic. Okay, in the right side is the hypotension symptoms like nausea, fainting, weak, or sleepiness, and in the left side are the pressure of diastolic and systolic mercury millimeters. And these symptoms can be more difficult or can affect the patient until they reach a low blood pressure, very low blood pressure, and can cause coma and death. Okay, my doctors, these three main tips and steps may help you to identify the disease. First, occasionally diseaseness or light weakness may be a relatively minor problem. But second, a mild dehydration, for example, from spending too much time in the sun or excess of exercise, as Adriana Smith. And always consult to your doctor if you have any sign of symptom of hypotension because they can indicate more serious problems. Finally, these are the references that I use for this presentation, and I hope you may found more easily to diagnose this disease. And that's all. Thank you for seeing.